Welcome back, everyone. With September just a few days away, it's time to talk about prostate cancer. September is National Prostate Cancer Awareness Month.
Prostate cancer is the second most common cancer in men, and the risk factor increasing significantly in men over 50. To tell us more about it, we've invited back Dr. Robert Princenthal, Medical Director of RadNet's Prostate Imaging Program. Thank you for being on this very important topic.
Thank you so much, Lauren and Lou. Glad to be here.
Yeah, so let's get to just the basics. What is prostate cancer? Who's most at risk for it? And how prevalent is it?
It's very prevalent. The incidence of prostate cancer is identical to breast cancer in women. So roughly 300,000 men and women are diagnosed each year of their diseases, and unfortunately 35,000 men and women die each year of their diseases. But we can screen prostate cancer with a PSA blood test, which we don't have for women with breast cancer. And you're right, men 50 and on have an increased risk of prostate cancer.
All right, so we talked about that number, but does it occur in younger men?
Just like with colon cancer, we're finding more and more men and cancer being detected younger. So for people with high risk, which are minority men, people who may have strong family history or genetic changes, we recommend starting screening at 45.
45 to start screening for high risk, and then what about when else should people get screened and who should get screened?
Well, all men should get screened. And the problem we have, at least in my clinic, every week I see a man presenting with a PSA of over 50 to 500, and they are metastatic of presentation.
What does that mean in layman's terms?
That means it's spread out of the gland, and it means their ability to have their disease cured is reduced. So just unfortunately, like with President Biden, he presented at the age of 81 with prostate cancer that already spread to his bone. So we're hoping that if we can get the word out and do population-based health screening and get more men to get screened, if we can find the cancer with a PSA 15 or less, we should be able to reduce the mortality by at least 20%.
Well, you had mentioned earlier that men are sometimes, not all of you, but that in your words, chickens sometimes when they're going to the doctor, right? And they get nervous, but you're saying now, like, get in there early, especially even if you don't have symptoms. And by the way, what are the symptoms?
Exactly correct. Prostate cancer frequently has no symptoms. And men confuse the symptoms of a big prostate, meaning that they have to go to the bathroom more frequently with cancer, and that's not true. So since it's asymptomatic, you need to get a PSA blood test. If it's over 2.5 to 3, ask for a prostate MR. And we can triage men who would benefit from biopsy by seeing a suspicious spot on the images. But more importantly, we can help men avoid an unnecessary benign biopsy by saying the gland looks good.
And the prostate's in a sensitive area.
It is.
So I want to be clear on this point. You're saying that you just have to do a blood test.
Yes, a blood test and a MRI, which is safe and non-invasive, and that's a very effective screen, and we can actually be more accurate for prostate cancer detection than we're doing for women with breast cancer.
If MRI, you know, those are expensive sometimes. If folks are out there like, well, I can't afford to do an MRI, the blood test is first key.
The blood test is cheap and covered by insurance, but RadNet is offering a program called EPS, an Enhanced Prostate Screening, and we're offering a non-contrast prostate MR for $275. So cost should no longer be a barrier to get screened. But more importantly, I think men tend to be more concerned about the side effects of treatment rather than the disease itself. But with newer technologies and advancements with treatment options, the risks of the functional side effects have really gone down.
Really important points, Dr. Princenthal. Thank you so much for being on with us. We appreciate it. We'll be talking about this all month of September. You're wearing your blue ribbon pin, which you said
really
is for prostate cancer awareness. So thank you so much.
Thanks for getting the word out.
Yeah. All right. For more information, you can visit radnet.com, and we're going to check in now.